Aguilar, your medical technologist for today. So for today's video, we are going to perform the proper physical examination procedure of our specimen, which is the stool, or so we call feces. So accompany me on identifying the color, odor, and the consistency of our specimen. So the materials that we needed are specimen container and non-applicator stick. So the first thing that we must do is to wash and sanitize our hands before putting the gloves. The first thing to do in the procedure is to pass out stool in a bedpan lined with newspaper. Also, avoid mixture of urine, fibers, dirt, gauze threads, and tissue papers. I did not get to record this on video because my sister is my volunteer patient. I just gave her the specimen container for her to get me a sample of her stool for me to examine. Then we need to fill our patient's information such as the patient's name, age, birth date, and sex. Also the date and time of collection. Then, by means of an applicator stick, get a pea size or marble size of stool from the mid portion. Also, if a portion of the specimen is mucoid or bloody, collect from that portion. Then, in case of liquid stool, collect 10 ml or 1/3 full of an 8-ounce container. Next is to examine the specimen immediately. I use a glass slide where I can put the specimen, and I broke the applicator stick into two for me to be able to examine it properly and identify the parameters that we need to assess, which are the physical properties of our specimen, the color, odor, and consistency of it. Last one is to note the information that we assess on the stool. The color of the stool that I examined is brown, which is normal because the poop is naturally brown due to the bile produced in our liver. Then, the odor that I observed is just the normal odor of stool. So basically, the odor depends on the pH of the stool. Indole and scatol are the substances that produce normal odor formed by intestinal bacterial fermentation and putrefaction. Last thing to observe is the consistency of the stool, which in my examination of the specimen, the stool's consistency according to the Bristol chart is type 2. Type 2 stool consistency are lumpy and sausage-like, which result to slightly constipated patient. After completely examining the specimen, we'll just jot down the information that we collected through this procedure. After the procedure, dispose all of the material properly. So that's how we perform a proper physical examination procedure of a stool. Thank you for watching.